And the final thing I want to look at, the seventh complication of immobility, are complications to do with the mind, psychological complications. And if this is severe enough, patients can become anxious and depressed. It can become actually psychiatric complications. So let's think now about psychological complications of immobility, those to do with the mind rather than to do with the body. Psychological type complications. Well, whenever someone's ill, depression is likely to occur. And especially with immobility, these patients very often do tend to become depressed. So try and prevent depression and recognise it early so it can be treated if it does occur. So how do you prevent depression? Well, basically, you've got to give something for your patients to live for. And I think the most important thing in people's lives are other people. So keep them stimulated with other people. It's very important that friends and relatives are allowed to visit whenever they want. It's very important that the patient can interact as much as possible with friends and relatives and carers. So keep the patients interested in life. Give them things to occupy their mind so that they feel useful and still productive. People like to feel useful and productive. So give them things to do within the limits of their mobility. Stimulate them with things they are interested in, with interests, with hobbies, with magazines, with watching some TV programs, or whatever it is. Keep the patient's mind active, keep them useful, keep them involved with the people that they have been involved with in the past, and just try and maintain life for them as normal, the mental life anyway, try and maintain it as normally as possible to try and prevent depression occurring. So depression, a potential psychological complication, and if it's bad enough it becomes clinical depression, that would then be a psychiatric complication. Boredom, of course, these patients often become very bored. They're just sitting there in bed immobilised, very bored, very frustrated. And the treatment for boredom basically is the same as depression. Try and keep their minds stimulated and keep them doing whatever they can do, keep them as active as possible. Now, one thing you often don't think about is that using your body is a form of non-verbal communication. So when you can move your body around, we actually communicate with our bodies as well as communicating with our voices and with our facial expression. So remember that the patient cannot communicate in quite the way that they normally would communicate, and this can make them frustrated. They might be unable to express emotion, for example. Very frustrating if you can't express emotion. So maybe one of the key things here is to take time to allow your patient to communicate with you. Remember that their communication is inhibited, so take time. Sit on the edge of the bed, and if they're taking several minutes to communicate a simple concept, take that time, sit there and listen attentively to what the patient is saying, and then you can maybe rephrase it or paraphrase it so the patient knows that the message has got across and that they know they've communicated. It's very important for people to be able to communicate with other people. So take time, listen attentively, don't rush the patient, don't make them feel any more frustrated than they already are due to their lack of ability to communicate non-verbally. Anger is a possibility as a reaction to any illness, and the patients can be angry that they're immobilised and angry that they have the condition which has caused the immobility. Fairly hard to deal with, really. Just really allow the patient to work through it on their own with people that they can confide in. That's perhaps the main thing. But realise that it may occur and that it's not necessarily an abnormal reaction. Anxiety. Patients are very often anxious. Are they ever going to get better? So anxiety is a major problem. Altered body image. Remember, body image is not just the gross structure of the body, it's the whole presentation of the person to the outside world. And a lot of the way we present is actually in the way that we can move around. If that is interfered with, then there'll be altered body image. There can also be grieving for the function which has been lost. So grief reactions can occur. And the patients can feel helpless and hopelessness can set in. So the attitude of the carer is very important in dealing with all of these possible psychological reactions. Now obviously there's going to be many care deficits to think about. And in this sort of situation, nursing needs to take care of things that the patients would normally do for themselves, but are unable to do so because of their immobility and because of the pathology which caused that immobility. So there's going to be self-care deficits which need to be matched by nursing interventions. We're not going to do these in detail now, we'll cover these separately. But just a few specific things here. Remember, the patients, if they're immobile, might be unable to move away from noxious stimuli, from things that are hurting them. So, for example, they might be sitting in a very, very uncomfortable position, or sitting on their hands or some other part of the body that's got pins and needles, and be quite unable to move away from that nasty situation. So, remember that the patients can't move away from possible painful stimuli themselves, and we must do that for them. Patients are unable to defend themselves. This can make patients feel very vulnerable. So, for example, they won't be able to defend themselves from children who may be overzealous in play. They won't be able to defend themselves from animals or from bees or wasps or insects. So again, we need to take over this role and make the patient feel confident in us, to reduce their anxiety, make them feel comfortable with the fact that they know they can trust us because we've taken over their self-defence needs. Certainly with loss of self-care ability and activities of daily living defects, which all need to be considered and taken care of in basic aspects of nursing care.